So it finally happened. 2025 was the year that natural facial rejuvenation finally won. Overfilled faces are out, comprehensive surgical approaches are in, and patients are getting smarter on what actually works. But 2026 is going to be different. Today, I'm breaking down 6 biggest shifts happening right now that will define aesthetics in 2026 and beyond. I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And if you want to be the first to know what's on the horizon for anti-aging and skin health for the next year, make sure you watch this entire video all the way through. And at the end, or now, subscribe to my channel to help you make the best choices for yourself. This is what this is all about. All right, so let's get right to it. Trend number 1 is surgeon specialization. I recently attended the American Academy of Facial Plastic and Reconstructive Surgery annual facial plastic surgery conference, and one thing became crystal clear, which is the era of the generalist is starting to end. We're seeing more surgeons laser focused on one procedure done at the absolute highest level, and not somebody who does facelifts and breast augmentation and tummy tucks and rhinoplasty, but surgeons who will literally devote their entire practices to only one procedure. I can't stress how important this is. Every year I get invited to give talks at this meeting to my colleagues. Every year in the past, I've been so amazed when I'm in there talking on my vertical restore or facial rejuvenation surgical procedures. In the other room, in the other hall, there's somebody talking about where you can place fillers in the cheek to create a shadow and hide laxity or hide a jowl or whatever it is. In my room, 1/3 of the seats were filled. I'm always amazed. I spent all this time preparing, sort of sharing my wisdom and my experiences on, complex and surgical techniques, and literally only 1/3 of the seats are filled with people in there. Then I happen to walk across the other room where there's somebody talking about fillers, etc., and standing room only, packed. I was always shocked by that. I thought to myself, these people are missing out on an opportunity to learn a technique that is never going to go away. It's only going to get stronger. I knew this for the last 20 years, so I've really personally went all in on it. Along the way, people are making the opportunity cost of not learning it and spending their time with these non-surgical techniques. Well, this year was the first year that there was literally standing room only in the talks that I was giving and my colleagues were giving on the topic of facelifts and facial rejuvenation. So a very, very important observation and trend heading in this direction. And ultimately, this is one of the most important things because experience and depth of skill beats breadth every single time. So being one of these, jack of all trades isn't going to cut it when it comes to creating the absolute best type of results you can for patients in any type of procedure. And I've always said this, whether you're having a root canal or whether you're having a facelift or a rhinoplasty or a hernia repair, go to somebody who does it on a regular basis, who's truly specialized in. You're much likelier to get a better outcome, less complications, and a more consistent overall result. And that's what you want when it comes to procedures. And this is really the fact of why I stopped, 6, 7 years ago, stopped doing rhinoplasties and other types of cosmetic procedures in my practice, and I focused exclusively 100% on facial rejuvenation, and in this case, the vertical restore facelift procedure that I perform. So when you are choosing a surgeon, no matter who it is, you want somebody who's done your exact procedure hundreds, if not thousands of times, not somebody who does it occasionally, once or twice a month or whatever it is, but you want somebody who's devoted and truly a specialist in that particular area. That's where you see mastery, focus, and the goal of creating natural results and reliable results actually happen. It's that intersection where somebody has given themselves complete dedication over a period of time. They can get the results that you deserve to achieve for yourself, because the face is not something you want to mess around with, all right? So we're trending in the right direction there. Number 2, celebrity disclosures. So this is interesting. There's a time, obviously, not that long ago, I think really before 2025, when celebrities would get procedures done, everyone could tell they've had something done, but they were denying it, completely. Suddenly we're seeing more and more celebrities coming out and being forthright about their procedures. That's a big shift. And I think it's a shift that we'll continue to see in 2026. And I think it's really going to, be helpful as this happens. And we saw this, for example, with Kris Jenner, with Kathy Griffin, who also was very open about it. And we actually did an entire video on this recently where we discussed Sia, Marc Jacobs, Jane Fonda, Sharon Osbourne, and really discussed their stories and their decision-making. But even since then, there's been other ones like Kat Sandler and Ricky Lake, et cetera. And the list is going to get larger, although it's still pretty small. It's going to get larger, in my opinion. And ultimately, why this matters is when you get high-profile people who are in the limelight and people are aware of their decisions, and when they can make a good decision, that helps inform other people's good decisions. Because ultimately, they are, whether we like it or not, in a position of influence. And when they're honest about these type of things, there's three things that happen. Number one is it reduces stigma, which improves the decision-making for everyone. I mean, there's so many of my patients who struggle with the guilt of doing something like this because they feel like there's a negative stigma around a facelift. And that's definitely been trending in the right direction over time. But when you can see the celebs talking about it and more open about it, it makes it easier to discuss it as well. So it sets that up, but it also sets realistic expectations because you can see real before and afters, not just filters, et cetera. So in addition to all the ones that, practices like mine show, it's also very powerful to see somebody you've known and you've seen age come back and look a little younger. And especially if it's good work, it confirms, good things. And if it's poorly done work, it gives you information in a different way that you can use as well so that you don't fall for the same poor decisions that particular celebrity went for. So all around, very good. Two, it elevates the standards. When you do see somebody that has had good work, then people are going to demand that level of outcome. I'm truly known for creating really natural and unoperated looking outcomes for 20 years. That's been my MO. That's why patients travel to see me from everywhere. And to see that there's more and more high profile people sharing, that makes it harder and harder for surgeons to not completely devote themselves to creating similar type of outcomes, which ultimately means that the patients will get a better outcome. If their surgeons are trying to meet that watermark of creating these really natural, beautiful looking results, well, they're going to work harder. They're going to learn techniques. They're going to do whatever they got to do to get there, because if not, no one's going to go to see them. And that's simply the reality of it. This is one of those things that'll float all the boats. It creates a transparency domino effect where more and more people feel comfortable speaking up and discussing the procedures they've had done. This openness has fundamentally changed patient conversations. We're moving away from the shame and secrecy that I just alluded to towards education and empowerment. That's a beautiful thing in my opinion, and I think that's something that I've always been advocating for and really grateful for all my patients who share their entire journeys and their stories, whether it's on YouTube or Instagram. So brave of them to do so, especially at a time when it was less popular to do so. Now more and more people are sharing, and that's a beautiful thing for this industry that I hope we'll see a lot more of in the coming year. Trend number 3, fat transfer is having a moment. So fat transfer has been around for literally decades. I mean, I've been doing it, I think, daily for 20, 25 years or so, and it's been around for another 20 years before that. So it's nothing new. But what I expect to see in 2026 is that it's finally getting the recognition it deserves. And the data backs it up. If you look at this, search for interest for fat transfer on the internet, you see fat transfer spiked significantly from 2024 to 2025. So what's driving this increase in demand? Here's what I think is going on. Number one, first, the patient education. People are learning that your own fat is the most natural, long-lasting option for volume restoration. And for those of you who don't know, we lose some of that volume as we age, and being able to replace like with like, in this case, replace fat with fat, is the most natural way to do so. It also integrates into your tissues as you age. It doesn't migrate or create that puffy and overfilled look. Again, assuming it's done properly in the right hands and the right expert hands. It's a beautiful thing versus the repeated filler use that can sometimes get out of hand just because of the sort of indirect effects of filler being kind of like a sponge. And number two is the GLP-1 medications like Ozempic and Mounjaro, and the NIH study that just confirmed what we were seeing in our practice, which is, more people are experiencing facial volume loss from weight loss drugs and seeking facial volume restoration, and that fat transfer is the gold standard solution for that. Third, the backlash against fillers. And this is something that, fillers were reigning king and supreme for almost 20 years, really. And after years, we start seeing, these cases of pillow face, overfilled disasters, both in celebrities as well as in the lay public. And the reason why this was happening was people were trying to avoid having surgery by filling the face. And the problem is the paradigm was wrong. The foundation of the decision was wrong. Volume loss isn't the only reason why your face is sagging. It's one of the reasons why your face looks tired, but it's not one of the reasons your face sags. And by filling it and overfilling it just to try to get the laxity out of the way isn't going to result in a youthful, natural look. So that's what we started to see. And people started to get a little bit of a bad rap associated with fillers. And fat transfer is ultimately the better solution, in my opinion. But either way, both of those options, whether it's filler or fat transfer, need to be done very carefully and also very judiciously. You don't want to do too much of it. I'm not an anti-filler person. I just anti-overfilling and obviously using it as the wrong tool for the wrong particular problem. So if you're considering, volume restoration, make sure you check out my video, fillers versus fat transfer, and how to choose the best option, for your needs. It really helps clarify some of the facts around it. Number 4 is a reduction in non-surgical treatments. So as I mentioned at the AFPRS conference that I was at, there were much fewer energy device treatment talks, fewer thread lift talks, and way more conversations about why non-surgical approaches underdeliver in different situations, both in terms of actual talks, but also just kind of among colleagues and talking. So my feeling is, and my observation is that there's a pendulum swing happening. And you can see it on social media as well, where there's a kind of a blossoming wave of negative conversations around things non-surgical and the inadequacies and the ineffectiveness of this. And again, it doesn't mean that these things should not be used. It's just that the expectations that were associated with their use was wrong, right? I mean, so if you think about, if you're telling somebody, hey, you can use this in place of surgery, and they end up using it and it doesn't replace surgery, it doesn't get them anywhere. I mean, how many times are you going to be able to say that with a clear, non-result for the person to realize that, hey, this isn't living up to the expectations, right? So patients are also sharing their negative experiences with Morpheus 8. You saw that there's an FDA piece about that, all therapy, threads, and it's finally starting to resonate. And I think ultimately this is a good thing to have perspective in terms of expectations around this topic. And what I'm sensing a lot more is there's a narrative that's shifting away from, I can try to avoid surgery, to, I'm actually not going to waste my time and money on things that don't work. So to be clear, I've been saying this for years. I've been trying to educate and offer my experience from my patients and the observations that I've had from thousands of people that I interact with on a regular basis. But it's nice to see some of this is starting to percolate and more people are starting to make better decisions. And ultimately, as long as you know the facts and the information around these decisions, you should be able to make the right one for yourself. And that's what this is all about ultimately. But I have to say, it is nice to see that there is a broader industry-wide and patient base that are catching up to some of the things that I've been talking about. And when I used to initially talk about them, it was met with so much resistance and almost shock that I'm saying these sort of things. So it's nice to see that there's a little catch-up going on here. And here's what I'm saying. So Botox, lasers, chemical peels, IPLs, standard microneedling, without radiofrequency, and of course, clinically backed skincare are all super, super important and not going anywhere. Everything else is fading fast. Trend number 5 is smarter, simpler skincare. First, let's talk about what's out in skincare. Well, it's not quite out, but it's kind of heading in this direction. And that is like these massive 10-step routines. They're simply not sustainable for long term. Most people can't do a 10-step routine day in and day out, year over year. It's a time commitment as well as almost like an inventory challenge. Like, how do you keep up with products running in and out and all this kind of stuff, and then you start skipping days, etc. So 10-step routines, they've always been kind of a failure, and they're failing. Miracle ingredient hype. I mean, this is a tale as old as time, right? And when it comes to skincare, there's always a miracle ingredient and like the whatever coming out. The fact of the matter is, I think people are becoming wiser. I think they've had the wool pulled over their head one too many times, and they're looking for real results, and they're not going to fall for things just because somebody in a white coat tells you that this is the way it should be. You're getting a little bit more educated and discerning, and I certainly dedicate myself to helping you all make those good decisions with good content on this that are not hype oriented or marketing oriented, but just kind of simple facts, and we're seeing that play out. Here's another one: complicated layerings of protocols on, day off schedules, right? So I certainly am not a fan of this called like skin cycling, days of the week you do this, days of the week you do that, and then in the summer you do this, in the spring you do that. All of that is overly complicated. It's going to trend in the negative direction. You'll see in 2026 trending nonsense with no clinical backing. Again, I think we are finally at a place where people want to see clinical proven results. They expect real results. I think what you're going to see, and what's really going to be in 2026 is simplified, clinically backed actives, things like retinol, vitamin C, niacinamide peptides, ceramides and hyaluronic acid, those kind of powerhouse ingredients. Consistency over complexity is always going to win. 3 steps you actually do beats 10 steps you'll quit on. Longevity-based thinking, you're thinking long-term, you can get ahead of the skin aging and anti-aging sort of processes. We're not chasing quick fixes. We're willing to do longer term commitments because we understand science a little bit better. We understand what it takes to create foundational skin health. And as more and more regenerative skincare concepts come into play, things that stimulate collagen and repair DNA and support your own skin's biology, we're going to see those become much more powerful. And this is really what I think the future of skincare actually is. A skincare system that actually covers this foundation that I would strongly recommend, of course, would be the Karam MD trifecta. From my point of view, a lot went into developing it so that it could be effective, it could be simple, and that you could use it over the long run without having all of the challenges that go into these multi-step routines and ultimately being let down by either the fact that you can't stick with it or the fact that it doesn't work. But using and leaning heavily on those important and hardcore actives is where you're going to see the real results. So if you want to learn a little bit more about the formula and the Karam MD trifecta, make sure you check out karammdskin.com, and do yourself a favor. If you do get started, give yourself a solid 90 days of commitment and see if you're not hooked by then. You will be absolutely hooked. You'll see all sorts of amazing changes, and we've had over 14,000 people every day using the products and loving it. So again, overall, the future of skincare isn't about more products. It's about smarter products used consistently. Trend number 6, holistic rejuvenation becomes the standard. Now, this is another one of those things I've been talking about actually for 20 years. It's about using a comprehensive approach. And what I mean by that is there's 3 parts of the face that are actually aging. There's the skin, there's the volume, and then the shape. All 3 of these things need to be rejuvenated in order for the face to look truly younger. And this is what I've been dedicating my entire sort of practice to. I treat skin, I treat volume, and I treat shape, right? So in 2026, it takes it even further into this holistic rejuvenation concept that, again, we want to see more and more practices embracing. And actually, this is what I think holistic is going to mean in 2026. It's going to go beyond just the procedures. It's going to go beyond skincare, fat transfer and a facelift, which is kind of how I have always described it as. But what is going to happen is we're going to look at holistic as rejuvenation, addressing things at the biological foundation of aging. And what would that, potentially look like in practice? Well, your internal health is going to be a big part of this. So focusing on nutrition, exercise, sleep quality, stress management, huge factors in terms of speeding up or slowing down the aging process. Lifestyle factors, things like not smoking, decreasing sun exposure, minimal alcohol exposure, all the things that we know can actually speed up skin aging. And of course, the skincare foundation, using biological actives to work at that foundational level combined with sun protection, and then combining that at the end when you are finally ready with a surgical intervention to address laxity, well, boom, then you've got a totally holistic approach. You're all in on the anti-aging process, and that's where you're gonna see the intersection really blow up and things are gonna get really great. And the best way I can think of it to describe it to you is, and I've seen this thousands of times, somebody comes in for surgery, has really rough looking skin. They don't sleep well. They don't eat properly. They're not taking great care of themselves. Well, the surgery only looks so good. Now, on the other hand, you got somebody who's taking great care of their skin, completely devoted to their lifestyle, sleeping well, exercising well, eating well, and then you do a facelift on them, fat transfer on them, boom. Now all of a sudden you're looking at a 30-something-year-old looking back at you. I mean, it's incredible what a difference it makes to combine all these different factors together. A lot of times on these podcasts, et cetera, I'm asked, what does the future look like when it comes to regenerative medicine? And honestly, I think that should be part of the conversation too. I don't think we're there yet with exosomes and some of these other, really kind of like exciting biological things. But once we get into a place where we can actually repair the aging changes at the molecular level, well, that's going to be even more exciting, right? Even a very much more sort of biology first sort of approach. But that's going to take a bit more time for us to finally get there. But I think that's where the aesthetic field is going to go, and that's where it's maturing. We're not chasing isolated quick fixes. Instead, we're going to be looking at realizing the entire system where it needs to be and optimize it at the foundational level to get the best outcomes and help people ultimately look as young as they feel, which is really what this is all about anyway, isn't it? All right, so in conclusion, here's the big picture. In 2026, specialization over generalization, transparency over secrecy, fat transfer over filler overload, quality surgical results over non-surgical hype, smart, simple skincare routines over complicated routines, holistic, biology-first approaches over isolated quick fixes. I would say that the industry is growing up, evolving, and maturing. Cookie cutter approaches are dying. Patients are becoming more empowered. Providers are rising to meet the standard. This is evolution in its finest form, in my opinion. I think it took a very, very big step in 2025, and I'm very excited to see what things look like on the horizon in 2026 and beyond. All right, folks, so if you found this helpful, make sure you hit subscribe and share it with some friends and family. We break down these topics every single week. And if you want to dive into a little bit more depth on these topics, the Karam MD Journal is a newsletter that is free, delivered to your email inbox each week. So make sure you subscribe to it as well to get these elevated insights that you can use all the time to further empower you and make good decisions. And if you enjoyed this video, make sure you drop a comment, but also let me know what you see as predictions or anything you'd like to see. Thank you so much for watching and being part of this community. I value each and every one of you. Happy holidays and a happy new year. And until next time, Dr. Amir Karam.